right, good morning. My name is Ed Mollio. I serve as Director of Communications for HealthReach Community Health Centers. It's my pleasure to speak to you today from one of our local practices. This is the Belgrade Regional Health Center. The HealthReach organization is composed of 12 community health centers throughout central and western Maine. Our other locations include Albion, Bethel, Bingham, Kingfield, Livermore Falls, Madison, Rangeley, Richmond, Strong, and the village of Cooper's Mills within Whitefield. Our newest practice is the Lawrence High School Health Center, more commonly known as the Bulldog Health Center, after the school's mascot, within its namesake school in Fairfield. Since 1975, the communities that make up the HealthReach service area have worked together toward a vision of community health where everyone is welcome. In our last year, HealthReach has served more than 26,000 people from 9 of Maine's 16 counties. Our last year's appointments numbered more than 105,000. Through our Connector program, we saved our patients more than $705,000 in medication costs. As members of these communities ourselves, providing access to local, quality, and affordable health care is both a calling and just plain old common sense. Our medical director and local primary care physician here in Belgrade, Dr. Amy Madden, explained the challenge best when she said, "When healthcare is unaffordable, people delay seeking the care they need, which often results in worse health outcomes. It also means that when a health crisis hits, their household may accumulate bills they can't afford to pay, adding financial stress on top of their health issues. Our connectors, who are trained as Maine enrollment assisters, will work with anyone, both established patients and all Mainers new to HealthReach, to learn more about and enroll in the marketplace insurance plan that's right for their budget. HealthReach additionally offers an income-based sliding scale program to which our patients can apply for reduced service fees if they qualify. We reduce cost barriers so people can get the health care they need when they need it. A significant part of our cost-saving measures on behalf of our patients involves our support for the Maine health insurance marketplace. In 2022, the HealthReach Connector team helped Mainers navigate CoverME.gov across more than 900 appointments. Anyone interested in reaching a HealthReach Connector is invited to call our main office at 800-299-2460 or to visit our website at www.healthreach.org and click on our locations for the phone hours and contact information for your local health center. Please know you do not need to live near one of our health centers to access our assistance in navigating Maine's health insurance marketplace. HealthReach is proud to offer marketplace navigation and assistance services alongside our primary and preventative care. Our established patients also have access to behavioral health services, essential lab services, and other important health resources. Offering all of this affordably and under one roof is a great boon to rural Mainers, and being able to connect our community members with health insurance serves to tie it all together. It is now my privilege to introduce a stalwart ally in our striving towards more affordable health care for our state, the Governor of Maine. She has expanded healthcare to more than 90,000 Maine people, cut the uninsured rate by more than any other state in the nation, enacted legislation that has brought down small business health insurance premiums for the first time in more than 2 decades, and she just so happens to come from a town at the heart of our service area. Janet Mills, thank you for joining us.
Thank you very much. Thank you for having us here today. And look, it's often, I go by this place thousands of times on my way to Farmington from Augusta, from my midweek home to my weekend home, and I admire the work of HealthReach and other facilities such as this, really truly reaching out to the people and communities across the state to provide meaningful and accessible and affordable health care to folks. And it's often said, but it's also true, having health insurance in this country saves lives. And like many people across Maine, I have loved ones, neighbors, and friends who've gone without care because they didn't have health insurance. My husband, after his stroke, was in and out of rehab and hospitals and facilities, and I had to fight the insurance company constantly to make sure that he had the kind of care that he needed. I know what that struggle is about, but there are others who don't have any health insurance. People like my friend Patty. Patty was a vibrant, intelligent, a charitable woman, a friend to all, an athlete, a runner, and a mother of 3 wise adult children, loved by all and uninsured. She died just a few years ago. She died needlessly from breast cancer, a disease that could have been diagnosed earlier and potentially treated and cured. Her life could have been saved. Patty's story is not unique. Many people have friends like Patty, and their fate is simply unacceptable. That's why over the past 5 years, my administration has fought to make health insurance and health care more accessible and more affordable for Maine people everywhere. As you recall, my first act as governor was to expand Medicaid Maine Care in Maine, consistent with the will of the people who had already voted to do so. As a result of that action on day one, the executive order, more than 100,000 people now across Maine have access to life-saving health care. A few weeks after that, I worked with the legislature to enact insurance protections for people with pre-existing conditions and to ensure coverage of essential health benefits. And my bipartisan Made for Maine Coverage Act, Made for Maine Health Coverage Act, authorized the creation of a state-based health insurance marketplace at CoverME.gov, CoverME.gov, to help Maine people, including small business owners and self-employed individuals, access affordable health insurance options. Thanks to those efforts, Maine's uninsured rate dropped from 8% in 2019 to 6.6% last year. So those people no longer have to delay or avoid altogether health insurance, health care, a visit to the doctor, an annual exam, a diagnostic routine measure to prevent health tragedies. This is meaningful progress, but we're here today because December 15th is an important deadline. It is the last day that Maine people can sign up through CoverMe.gov for affordable, quality health coverage, which kicks in January 1st. So by enrolling this Friday the 15th, will ensure that your coverage takes effect January 1st, just weeks away, preventing any gap in your medical or dental insurance as well, because we expanded Medicaid, Maine Care, to cover dental. Even if you couldn't afford it before, please visit CoverMe.gov to evaluate your options. About 4 in 5 people who have signed up so far are eligible for financial assistance. That's important. Don't be deterred by the possible price. We'll help you find affordable health insurance. You could get high quality insurance coverage for your family while saving money in the new year. If you need health insurance for yourself, for your spouse, your children, do not wait. Log in to coverme.gov today or call 866-636-0355. 866-636-0355 or 711 to reach TTY. There are people standing by, ready to help you enroll at no cost to yourself. Please spread the word. Make sure that no person in Maine loses a friend, a neighbor, or a loved one like my friend Patty, only because that person didn't have health insurance. Let's keep Maine people healthy. Let's keep them insured. Thank you very much. And now I think, Jean, Commissioner Lambrew.
Thank you, Governor. And I do want to thank you, Governor, because without your leadership, we would not have CoverMe.gov, which, as a reminder, is a state-run health insurance marketplace. We are one of 19 states that run it on our own, and there's a real advantage to doing that. We can really look at what our Maine population needs, try to communicate to them in ways that are meaningful to them, and really try to go to communities and figure out how we can explain what health insurance is, why it matters, and why they should sign up. So CoverMe.gov is entering its 3rd open enrollment period, and we're very excited about that. It's especially important though this year because during the public health emergency, during the pandemic, we did not disenroll people from Medicaid. We didn't want people losing their health insurance in the middle of a pandemic when they might have needed hospital care or treatment. But with the public health emergency ending, we are now going through and checking your base eligibility. That means some people no longer are income eligible for Medicaid. But the good news is we have affordable options through CoverMe.gov that may meet their needs. So anybody who this year has lost their main care coverage because their income may have been too high should come to CoverMe.gov. Check it out. As the governor mentioned, 4 out of 5 people will qualify for lower premiums or reduced cost sharing through CoverMe.gov is the only place that you can get that kind of federal financial assistance. As the governor mentioned, the deadline's coming up for January 1 coverage. We don't want people to have a gap because it just takes one injury, one illness in that kind of coverage gap to wipe out your savings or make it hard for you to get the kind of treatment you need. So we urge everybody by Friday, December 15th to go to CoverMe.gov or to call 1-866-636-0355 or TTY 711. You also can get local help. As Ed mentioned earlier, Health Reach offers one type of local help. You can find on CoverMe.gov other free help to help you figure out what options are best for you, and we urge you to do that as soon as possible. So with that, I am thrilled to be able to turn this over to our new director of the Office of Health Insurance Marketplace, Hilary Schneider.
Thank you, Commissioner. Good morning. As Director of the Office of the Health Insurance Marketplace, I'm happy to be here to help spread the word about this important deadline this Friday, December 15th, for January 1st coverage as part of the 3rd open enrollment as a state-based marketplace. Please enroll by 11:59 p.m. this Friday to make sure you have coverage in the new year. And our call center is open until midnight, so you can call them to enroll by 11:59. If consumers miss that deadline, they'll miss out on coverage for the month of January. But you can still sign up by January 16th, so you can have coverage starting February 1st. After that, the only way to get coverage in 2024 is to meet special enrollment requirements, like losing other health coverage, adopting a child, or having a child getting married, legally separated, or divorced. Those who already have coverage through CoverMe.gov will be automatically renewed into the plan that most closely resembles the plan they currently have, if they don't take any action. However, life changes, and so should your health insurance. So we encourage you to come in and look at your options to make sure the plan you have still works for you. There could be options that better fit your needs or options from another company that may be more affordable for you. And also, if you came in a couple years ago, please come and you found that it might have been unaffordable, please come back and try it out again. There's a new federal law that allows for more savings for more people to be eligible in Maine. So please make sure you check us out. And if you come in and it looks unaffordable, make sure you reach out and get local help, because there are experts around the state that might be able to provide you with affordable option that they can help you in your individual circumstance. I work with an amazing team dedicated to helping Mainers who are buying insurance on their own find and compare options for health and dental insurance. By supporting Mainers in applying for and enrolling in financial assistance, we help reduce the out-of-pocket costs consumers pay for coverage. Our goal is to provide a customer experience that makes comparing plans options easier, that helps provide improved transparency in terms of what the plans cover and what to expect it will cost you throughout the year, and provide free expert support either online, by phone, or in person to help navigate the application enrollment process. CoverMe.gov is a marketplace made for Maine by Mainers. All plans sold through CoverMe.gov are major medical plans that have been reviewed and approved by the Maine Bureau of Insurance. They provide comprehensive coverage, including preventive care like recommended health screenings and immunizations at no cost to the consumer, and also cover doctor's visits, prescription medications, mental health care, emergencies, hospitalizations, and more. When Mainers buy coverage through CoverMe.gov, They have peace of mind knowing the plan will cover routine medical needs as well as emergencies and unexpected health needs. CoverMe.gov is the trusted one-stop shop to find and compare plans and get financial assistance to help pay for it. Our team has been working with partners and communities across the state to spread the word about CoverMe.gov and what we offer. We have enhanced our marketing to include new outreach efforts on social media, radio interviews, and targeted emails to returning members and individuals who have started the application process. These targeted emails help provide personalized action steps to help consumers know exactly what they need to complete their application so they don't miss out on getting coverage. We're running ads translated into multiple languages, and ads are running on radio, TV, in print, and on buses across the state. We also work with dozens of community partners like Health Reach and Consumers for Affordable Healthcare and many others, and brokers that help us spread the word and help consumers enroll in coverage. And these efforts are working. Since open enrollment through CoverMe began on November 1st, 2023, more than 59,000 Maine residents have selected plans for health insurance in 2024. This includes nearly 4,500 new consumers and more than 14,000 re-enrollees who have actively chosen a health plan. As you've heard, 4 out of 5 enrollees qualify for financial savings. To date, we have enrolled more new consumers than we did during the same time last year. In the past 2 days, our consumer assistance call center has answered over 1,000 calls a day. Nearly 90,000 visitors have viewed the CoverMe.gov website. If you or someone you know has been uninsured and needing health care, you may know all too well that a healthcare diagnosis can lead to serious medical debt and even bankruptcy. It can lead to choices no one should have to make between food on the table, oil in the tank, or going to the doctor or filling a medication. So if you or a friend, neighbor, or family member lives in Maine and doesn't have health coverage, now is the time to change that. Go to CoverMe.gov to enroll, to find help in your community, to help you enroll, and call 1-866-636-0355 or 711 to reach TTY. CoverMe.gov cannot do our work alone. Thank you to the certified enrollment assisters and navigators, health insurance plans, and brokers who work with us to make open enrollment a success. Together, we are helping support Mainers across the state find and enroll in quality, comprehensive health coverage that fits their needs at a price that works. Now I'd like to introduce a representative from one of these important partners, Ann Wallison, Executive Director of Consumers for Affordable Healthcare.
Thank you, Hilary, Governor Mills, and Commissioner Lambrew. The efforts you're putting in to help people who need coverage get coverage are really remarkable and so important. So thank you for being here today in Belgrade. I am Ann Wallison, Executive Director at Consumers for Affordable Healthcare, which provides a statewide toll-free helpline that any person in Maine who needs health insurance can call and get free confidential help sorting through their options and enrolling in coverage. I encourage Mainers who need health insurance, who aren't offered affordable coverage through work, for example, or maybe who have recently lost other coverage, or who need ongoing health care or prescription medicine, to reach out to CoverMe.gov to explore their options. Affordable, comprehensive health coverage is available that provides coverage for important preventative services, ongoing care that people might need, or again, other services like prescription medicine or mental health care. There is a network of trained assisters that you just heard about from Hilary that can help Mainers understand and enroll in coverage. As this first December 15th deadline approaches for coverage to start January 1st, anyone who needs coverage should reach out to CoverMe.gov and look at their Find Help button. The Find Help button on their website can help you find help in their local community from trained assisters who again can help you sort through your options and also help you understand what financial help might be available to help you pay your monthly premiums. And as Hilary and others have mentioned, more help is available to Mainers to help pay their monthly premiums, And some people, many people, are actually getting help with other costs, including co-payments and their deductibles. We hear from Mainers every day who are often surprised and very happy to learn that they can get good coverage they can afford through CoverMe.gov. Mainers are receiving extra help paying their monthly premiums, which is available from the federal government for people who need it. People like Sammy, who lives right here in Kennebec County. She and her husband are both self-employed, and they are always happy to recommend CoverMe.gov to other people who are self-employed in Maine. Asher lives in Lincoln County. He's an arborist, climbing trees, cutting branches, helping clear away trees that have fallen during a storm. He relies on CoverMe.gov for his coverage that he can afford and relies on in case something happens and he needs health care. Lisa from Androscoggin County, she became ill and lost her employer-based coverage, and she was able to find coverage she can afford at CoverMe.gov that will help her recover from her illness until she can go back to work and transition into employer-based coverage. And then you have Amy, who changed jobs. She's not sick, but she knows accidents happen and that illnesses happen. And she is heading into the new year with a sense of relief and security and peace of mind, knowing that she has coverage in case she needs it. And then we have Jay Miller, who's kindly here with us today. He reached out to our helpline, and he was able to find coverage at CoverMe.gov that works for him, that he can afford. I urge any Mainer who needs coverage, even if they have looked before, to look again. Again, as you've already heard, additional help paying monthly premiums is available, and most Mainers are also getting help with cost sharing like deductibles and co-payments. As you heard, you can reach out to CoverMe.gov, look at their website, give them a call, or you can call Consumers for Affordable Health Care at 1-800-965-7476 for help finding coverage that works for you, that you can afford. Thanks again for being here today. We really appreciate it. And
We're good. Any questions? Okay.
Thank you.
Thank you.
Thank you.
Thank you for joining us.
Thank you all.